Hello students, this is Dr. Manjunath working as an assistant professor in sociology, SMGFGC Kabahalli, which is located in the district of Chamarajnagar. In this video today I am going to discuss about the programs to promote women's health in India. And this video will definitely will be useful to the fifth semester BA Sociology, particularly of medical sociology course of University of Mysore, and also to those who have same syllabus. And this is with reference to the fourth chapter, healthcare delivery in India. And I have already told you the session's topic is programs to promote women's health in India. So in the previous session, we had discussed about all the provisions of National Mental Health Policy 2014, and also we had discussed about significant, role of this policy played in increasing mental health in India. And in this session, we have a learning objective of to provide information about the programs to promote women's health. So we have that objective of making the students knowledgeable about these things, and can see that students will be able to understand later. This will be happening and they become more sensitized towards women's health issues. Apparently that is not the case in Indian society, where in majority of this gender, particularly weaker gender, has been neglected since long. In this session, we are going to discuss about these aspects. So, generally, you can see women's health is largely, neglected. So, this is a common trend which is happening everywhere, particularly in India too. So, women's health in India can be, examined in terms of multiple indicators, like, for example, geography, socio-economic aspects, lifestyle, culture, and other things also. So, to improve the health of women in India, so multiple dimensions of well-being must be analyzed, in relation to global health aspects. So, if we do that, compared to comparison to men in India, so then we can see that their status, particularly health wise, is very low. And currently can see that women in India face a lot of multitude of health problems, which ultimately affect, the economy's output also. So here, this is what you have to understand, because there are some statistics also. You can see that the United Nations, ranks India as a middle income country. Okay, so World Economic Forum indicates that the India is one of the worst countries in the world in terms of gender inequality. So this gender inequality, report also, it shows lower ranking and all. And there are some major, health problems pertaining to women, particularly about, numerous factors, particularly maternal mortality rate, adolescent fertility rate, educational achievement, labor, and etc. Labor force, participation. And gender inequality is there in India, where women's, lower livelihood of being illiterate, continuing their education, and participating in the labor force. This is happening in India. So gender mainly is about social construction. ಹಿಂದಿನ ಈ ಒಂದು ವಿಡಿಯೋದಲ್ಲಿ ಮಹಿಳೆಯರ ಆರೋಗ್ಯವನ್ನು ಅನಾರೋಗ್ಯದ ಬಗ್ಗೆ ಮತ್ತು ಆರೋಗ್ಯವನ್ನು ಸುಧಾರಿಸುವಲ್ಲಿ ಸರ್ಕಾರ ಕೈಗೊಂಡಿರುವಂತಹ ಅನೇಕ ಕಾರ್ಯಕ್ರಮಗಳನ್ನು ಕುರಿತು ಈ ಒಂದು ವಿಡಿಯೋದಲ್ಲಿ ನಾವು ಚರ್ಚೆ ಮಾಡೋಣ. ಪ್ರಮುಖವಾಗಿ ಜೆಂಡರ್ ಅಥವಾ ಲಿಂಗಭೇದ ಅನ್ನುವಂಥದ್ದು ಒಂದು ಸಾಮಾಜಿಕವಾಗಿ ನಿರ್ಮಿಸಿರುವಂತಹ ಒಂದು ವ್ಯವಸ್ಥೆ. ಸೊ ಇಟ್ಸ್ ಎ ಸೋಷಲಿ ಕನ್ಸ್ಟ್ರಕ್ಟೆಡ್ ಸಿಸ್ಟಮ್ ಹಿಯರ್, which affects on health, particularly on the basis of There are numerous programs which have been implemented by central and state governments to in order to promote women's health in India. So, out of these programs, the major ones have been selected here to understand and make you understand, particularly of Pradhana Mantri Matritva Vandana Yojana (PMMVY) has been started in the year of 2010 by Women's and Child Development Ministry. So, this program has a objective of conditional cash transfer for pregnant and lactating women of 19 years of age or for the above for the first live birth only. And this scheme is very important, and it provides say safe for delivery, child care, and good nutrition also to the women. And it provides a partial wage compensation also to women for wage loss during childbirth and child care. And also, it provides conditions for safe delivery, I told you. So, this has been a very important program for the promotion of health of women. And Pradhan Mantri Suraksha Matratva Abhiyan. This program was launched by Ministry of Health and Family Welfare, and it aims to provide free health checkups to pregnant women at government health centers and hospital. The national program, aims to provide pregnant ladies free antenatal services and required, treatment for the ninth of every month. So this program had a lot of objectives where we can see that providing health to the pregnant women was the major objective, and also lowering maternity mortality rate also, but and also to make pregnant women aware of their health issues and diseases. So making sure safe delivery and healthy life of the baby is happening. So this scheme was there for the pregnancy period of 3 to 6 months. So it provided free of cost tests, and particularly with major aspects and all. ಈ ಒಂದು ಪ್ರಧಾನ ಮಂತ್ರಿ ಸುರಕ್ಷಾ ಮಾತೃತ್ವ ಅಭಿಯಾನ ಅನ್ನುವಂತಹ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಅನ್ನುವಂಥದ್ದು ಈ ಗರ್ಭಿಣಿ ಮಹಿಳೆಯರ ಒಂದು ಆರೋಗ್ಯವನ್ನು ಸುಧಾರಿಸುವಂತಹ ಒಂದು ಉದ್ದೇಶವನ್ನು ಇಟ್ಕೊಂಡು ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ತರಲಾಯಿತು. Next one, Janani Suraksha Yojana. This program is also one of the important program pertaining to women's health. So this Janani Suraksha Yojana is a safe motherhood intervention under the National Rural Health Mission. So it is being implemented with the objective of reducing, maternal and infant mortality by, promoting institutional delivery, so particularly among pregnant women. So this is also very important one. So the scheme is under implementation in states and union territories with a special focus on low performing states, so that and also in this program pregnant women particularly belonging to BPL, SC and ST who deliver in health institutions will be monetarily benefited. So this program was launched in another major program to promote women's health is about accredited social health activist. So this is a community health worker instituted by the government of India's, Ministry of Health and Family Welfare as part of, National Rural Health Mission. So this is very important, and the mission was started in 2005 and fully implemented in 2012, the full implementation target. And so we can see a lot of 250,000 ashas in 10 states were there on that time, and it is still growing the number of asha workers and all. So this health family welfare department defines who is ASHA, accredited social health activist. So it's a person wherein the health activist in a community who will create awareness on health and also its social determinants and mobilize the community towards and also look health and other aspects also. So this another program of reproductive maternal newborn child and adolescent health program. So this essentially looks to address the major causes of mortality among women and children, as well as it delays in accessing and utilizing healthcare and services. So this program was started in 1997. ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮವು ಪ್ರಮುಖವಾಗಿ ಮಹಿಳೆಯರ ಅಲ್ಲಿ ಪ್ರಮುಖವಾಗಿ ಈ ಒಂದು ಆರೋಗ್ಯದ ಮೇಲೆ ಪ್ರಮುಖವಾದಂತಹ ಪರಿಣಾಮವನ್ನು ಬೀರುತ್ತೆ. ಸೊ ದಿಸ್ ಪ್ರೊವೈಡ್ಸ್ ಫೆಸಿಲಿಟೀಸ್ ಟು proper pregnancy and safe child birth also. So it concentrate on that, and the couples will also have so this guidelines and all those things. So counseling also will be given. So these things have been given in this. So next program is Janani Shishu Suraksha Karykrama. This program was started in 2011, and it to motivate those who still choose to deliver at their homes to opt for institutional deliveries, and it provides free and cashless delivery and free C-section, free drugs, and all many facilities are given in the under this one. ಜನನಿ ಶಿಶು ಸುರಕ್ಷಾ ಕಾರ್ಯಕ್ರಮವನ್ನು 2011ರಲ್ಲಿ ಭಾರತ ಸರ್ಕಾರ ಜಾರಿಗೆ ತಗೊಂಬರುತ್ತೆ. ಮುಂದಿನ ಒಂದು ಕಾರ್ಯಕ್ರಮವನ್ನು ನೋಡೋಣ. ನೆಕ್ಸ್ಟ್ ಪ್ರೋಗ್ರಾಮ್ ಈಸ್ ಅಬೌಟ್ ನ್ಯೂಟ್ರಿಷನ್ ಪ್ರೋಗ್ರಾಮ್ for adolescent girls. So this program was started in 2002 and 2003 with 100% central assistance, and it aims to improve nutritional and health status of adolescent girls. So it provides a lot of free services and all. So you can see here. Next one is about national nutritional anemia prophylaxis program. So this program had concentrated on reducing malnutrition and also to increase nutritional aspects among women, particularly mother and children. So this provided supplementary of iron tablets and all those things to women. In overall, you can see there are a huge number of programs have been implemented to promote women's health in India, but there are many hurdles and obstacles to fully implement these programs, and some programs are not reaching to the fullest to these women, mainly because of lack of awareness of health aspects among women, and lack of an awareness about concern for the women, gender inequality, social aspects. Because of all these problems, even today there are many women who are suffering health wise. So what governments should do, governments and intergovernmental or agencies, non-government organizations, they have to broaden their focus and also to work together in order to improve the women's health. Thank you for watching.